So, of course, with the vaccines rollout, that's really been the main topic for everyone, including for us at the news here. So there's been a lot of questions regarding vaccines. I know you guys have received so many, so hopefully we can answer some of those today. Let's go ahead and start with what phase we're in right now for Oklahoma.
Sure. So we're in the 65 and older phase. We're in phase 2, I should say, which includes the 65 and older. There's confusion because if you look at the vaccine plan, it says 65 and older and those with comorbidities. We have not moved into the comorbidity piece of that phase or that category yet. So we know that 65 and is the population that has been hit the hardest with COVID. We know they're the most vulnerable. We know that they are the ones that are being hospitalized at a much larger rate. If you look at our numbers yesterday, we reported 65 deaths in Oklahoma. 50 of those were 65 and older. So we want to make sure that we stay focused on 65 and older population. It's critical that we get them the vaccine. They have access to the vaccine. And because of the barriers with technology, as soon as we open it up to those with comorbidities, that's going to be a large group, much larger than the 65 and older. Oklahoma, we know we don't have the healthiest residents. And so when we open it up to those with comorbidities, that's going to be definitely, we're afraid it's going to push the 65 and older out where they won't have access to the vaccine. So we want to give them every opportunity they can to get access to the vaccine, to vaccinated, and then we'll open it up to the 65 and older.
Mm-hmm. And of course, another challenge for the 65 and older group has been the technology. There's a lot of people in that group who, may not have access to internet. And of course, in just a few days, we're starting the whole using the scheduler portal. So how are we, what are the things you guys are doing to give those people the access to the clinics?
So we've been collecting names. So if you call 211, their first question is essentially going to be, do you have an email address? Because you have to have an email address to gain access to the portal. So if you don't have an email address, then you're not going to be, the portal is not a viable option for you. So 211, when you call, they're taking down names. Every week I get a list of names of people, residents in our district who have called and asked for assistance. We're adding them, so we have a list of names. This is not the most efficient way to get an appointment. I would call on every Southwest Oklahoma resident to say, help your neighbor. Let's take care of our 65 and older. So if you know of someone who's not had access to a vaccine or is looking for their second dose, please help them, walk alongside them. So the email, it doesn't have to be their own email address. A single email address can be used multiple times. So if I wanted to go and help some of the 65 and older in my church, I could use my email address, sign up as many people as I can, and then just print the confirmation email back. Once you schedule the appointment, you can print that confirmation email. It has a QR code on it, and that's all they need to come and get their appointment. So they don't have to even worry with a computer. If somebody will walk alongside them, kind of adopt a neighbor, adopt one of our 65 plus population and help them maneuver through that portal. If all of those opportunities fail, if you still don't have access, we're reserving a certain number of appointments. So every time we have a first dose clinic, we pull back a certain number of appointments to fit in those people who have called, who we have on the list. As I mentioned, that's not going to be the most efficient way to get an appointment because we can't get a ton of people in at a time because we're doing paper whenever we do that. But it is a way that they can access the vaccine clinics without going through the portal. And then the other challenge is they have to get through to the county health department. So right now we have 5 clinics going on in Southwest Oklahoma. Staff are spread out all over Southwest Oklahoma giving vaccines. So that leaves few people back at the office answering the phone. So there's another frustration. When they call the health department, they're not able to get someone immediately. But again, if we could all just think of 1 or 2 people that we could help get through that portal, that scheduling portal, and help them get an appointment, the better off we're all going to be.
Absolutely. Well, Brandy, we could ask so many more questions, I'm sure, and we'll definitely be, keeping up with you every day to get the latest on, these topics as far as the pandemic goes. So we really appreciate you talking to us today.
Thank you. And Mackenzie, I just wanted to mention one other thing is that we will have both vaccines. So and people are very anxious if they're due their second dose that they can't get into that second dose appointment, that second dose clinic. We'll have both vaccines at all second dose clinics. So they don't have to worry about that.
Perfect. Perfect. All right. Well, thank you so much, Brandy.
Okay, thanks.